Okay, so are these past COVID positive patients testing again to get a negative test versus new symptomatic patients?
Yeah, we try, and again, that's kind of the conversation we had earlier this week, is there are some times that we actually do have to test the patient multiple times. So they might test positive on the first test. Let's say they need to be hospitalized, but before we can discharge them back to a skilled nursing facility under the state's new regulations, we actually have to test them until they test negative. So that's where we might run multiple tests on them. I said a week or so ago, if we have an employee that tests positive and we send them home and quarantine them, we don't test them again. We only we bring them back based on what the CDC calls time and symptoms. So 14 days quarantine, you have to be symptom-free for so many days, fever-free, without medication for so many days, and if you meet that time and symptoms, then we bring you back and we don't retest you. So generally we're testing patients only once. Now certainly if we had, say an employee or a community member that was showing symptoms and therefore was eligible to come to Floral Street and have a specimen collected, and they tested negative, but then days passed and their symptoms grew worse, we would probably bring them back and retest them. And it could just be that the virus was just starting to build during that first test and didn't have enough load to test positive, but as it continued to replicate, now they became sicker and now they're testing positive. So we generally only test one person one time, but there are times when we do have to do multiple.